Thank you, everyone, for tuning in today. Today, we're speaking with Dr. Brennan Spiegel, who is the Director of Health and Research from Cedars-Sinai. And today, we are speaking with him to gain insight on gastrointestinal disturbances that could also be symptomatic of the coronavirus, which, as we know, this pandemic that we are facing today has really caused some disruptions in our daily routine and how we choose to live our lives daily, and not even just in America, but around the world. So today we are hoping to gain some information about how this virus could potentially be spreading in other ways, and how we can, as a community, slow the spread. So today we just want to say thank you to Dr. Spiegel for speaking with us today about how the coronavirus could be more than just a cough, and how it could actually be our GI symptoms being also symptomatic of the coronavirus. So thank you, Dr. Spiegel.
Happy to be here. Sure thing.
So research has been supporting that coronavirus is not just the cough. What are some of the other symptoms that have been associated that patients have been reporting since the start of this virus?
Yeah, so when this virus was first described, the focus was appropriately on cough, shortness of breath, and pneumonia, because those are the symptoms that really cause people to seek care and to report to the hospital. Because naturally, if you can't breathe, that's really disturbing and requires, in many cases, urgent or even critical care. So a lot of the focus was on the respiratory symptoms. But it started to become clear that, people don't just have respiratory symptoms.
Right.
And in fact, some people don't really ever seem to have respiratory symptoms, but may have symptoms or gastrointestinal symptoms.
Right.
So we've been learning now, as we've studied the original data from the outbreak in Wuhan, China, that actually almost half of people, a little bit more than half, who came to the hospital for respiratory symptoms also had digestive symptoms. And about 20% of them had diarrhea in particular. And now we're learning that more and more people in the United States as well are developing diarrhea that's sort of new, that they may not have had before. So this is different, for example, than irritable bowel syndrome, where people can have diarrhea, for months and years.
Right.
This is new onset diarrhea, usually, but not always, but usually with a fever. And that's one way that COVID is definitely presented.
So, about how long can COVID-19 live within the digestive system before people even start having any symptoms at all?
So we don't know that yet for sure. We do know that the incubation period of this virus is generally between 1 and 14 days.
Right.
97% of people, if they're going to have symptoms from COVID-19, the novel coronavirus, they're going to have it within 2 weeks of exposure. Now, usually we've been focused on, again, the respiratory symptoms. And the question is it the same for the digestive symptoms? And we think it is. We think it is. It turns out that the virus can, of course, enter the body through the nose, through the mouth, and maybe even through the eyes. That's been suggested. But once it gets into the body, it can go in different directions. So, one direction, of course, is into the lungs.
Right.
But another direction is it could go down into the intestinal tract. And the way it gets down there is probably just through saliva. So if it's in your saliva because it's infected, for example, the salivary glands, and there's evidence that it can shed into the saliva, then if you swallow it, it can get into the intestinal tract. One thing about that is we have acid in our stomach, and that acid helps protect us against pathogens. And so we don't yet know, or at least I don't know, how effective our acid layer is at knocking down the virus before it makes it through into the intestines. And it is possible, although I don't know this for sure, but it's possible that strong anti-acid medicines could lower resistance for developing intestinal infection with COVID. And I think that's something that we need to study and learn more about, because I know many of your listeners have acid reflux disease and dyspepsia and maybe taking anti-acid medicines. I would not take this to mean that everyone should immediately stop those medicines, but I do think we need to study this and learn more about it. But it turns out once it gets past the acid layer into the intestinal system, it can gain entry into the cells that line the intestine. And it does that in the same way that it gains entrance into the cells that line the respiratory tract, because both systems, the lung and the intestinal tract, have a receptor on the surface of those cells that line the tubes. And that receptor happens to be called ACE2. And that receptor, believe it or not, is found much more commonly, 100 times higher levels in the intestines than in the lungs. So what that means is if the virus gets into the intestines, it doesn't take long before it recognizes one of those ACE2 receptors, latches onto it, and then gets itself infected right into the lining of the intestines. And we're now learning that it can cause inflammation of the small intestine. It can cause inflammation of the colon. It can cause inflammation of the liver. And it probably can affect the stomach and maybe even the esophagus. There's now reports of all of those. And I'm even starting to hear about the pancreas, pancreatitis. So that's a lot of sort of background, but that's part of what we think is going on with this virus in the intestinal system.
Yeah, so basically some of these would be alarm signs for people to look for, and are what other like alarm symptoms and signs should people look for that coexist with what we know are symptoms of coronavirus? And if someone has suspected that they may have been exposed to the coronavirus, like what action should they take when they realize that they may have some of these symptoms that you are speaking about today?
Yeah. So the first thing I would want to say, especially to an IFFGD audience, is that, gastrointestinal symptoms are common in general.
Right.
I mean, they're part of even being a human being. We all have times where we have stomach upset, where we have diarrhea, constipation, bloating, dyspepsia. So just because you're feeling that does not mean whatsoever that you have COVID-19. Not at all. In fact, chances are you do not have COVID-19. Now, we know COVID-19 is very prevalent right now, and it's very important, and we do need to be watching for it carefully. But I don't want listeners to think, oh my God, do I now have it because I have some diarrhea? So, but there are some caveats to that right now. The caveat is if you have not had diarrhea at all or for a while, and now all of a sudden you have new onset diarrhea, and you have had a known exposure to somebody with COVID-19 within the last 14 days, or a suspected exposure, it's definitely something to keep an eye on. It's something to watch out for. Now, if you also develop fever, now that is more specific to an infection like COVID-19, and you should definitely quarantine yourself, isolate yourself from family, friends, and call your doctor. That's good advice, whether we're in a pandemic or not. You should always call your doctor if all of a sudden you have a fever and diarrhea. The other thing that you should think about is how to try and reduce transmission, even if you're not coughing, because the focus on transmission has been respiratory, putting on a mask in particular, keeping socially distanced 6 feet or more. If you yourself have these symptoms, do everything you can to keep yourself separated from other people. If you're sharing a bathroom now, we have to start thinking about, is there a possibility of transmission through the stool itself?
Right.
And that's a whole question we could talk about.
Yeah.
And the answer is we do not know yet, but we'll talk about it in a second, I think. But before we get into the data on that, even until we know the answer, it sure makes sense to be super careful in the bathroom. Wipe down the toilet, wipe down the handle. If you're reaching for toilet paper, don't touch your face right after you've cleaned yourself. There's habits people have that they don't even realize it. When you flush the toilet, be sure the toilet lid is closed before you flush it. There is evidence that flushing can lead to a plume of aerosolized fecal matter that can rise up into the air, at least for some short period of time. Always wash your hands 100% of the time after every time you go to the bathroom. Maybe use different rolls of toilet paper for different people who are using the same bathroom. Just basic common sense stuff right now if you're having these kinds of symptoms.
I think you touched on some really good points that we kind of, we go through each day, and we go into the bathroom as part of everybody's days, right? So I think just realizing that we can slow the spread by just being more cognizant and aware of our bathroom habits, and kind of just doing our due diligence to make sure that we are washing our hands and doing things properly to kind of slow the spread. So, in part of that, I know we have a test for the coronavirus itself, but let's say someone goes and gets tested for the coronavirus and it comes back negative. How would they go about possibly requesting for a different test, and what would that test be when we're talking about some of these people maybe experiencing digestive symptoms? How could they go about getting a different test to basically confirm if they do or do not have coronavirus?
Yeah, this is a very common and important question. I'm hearing more and more people asking this question, so it's a great one. Now, the truth is, as of right now, as of today, we still can't even come close to keeping up with testing people who have respiratory symptoms.
Right.
To the point where many counties and regions and hospitals are saying to those patients, listen, let's just assume you have COVID-19. We may never know. We can't test you right now. And go home, monitor your symptoms, and work with your doctor to determine what to do next. That's not a very satisfying answer. But that is an answer being given right now, even to people who have cough, shortness of breath, chest pain. So you can imagine people who now have diarrhea, nausea, vomiting, abdominal pain. They're even lower on the list of people who are going to get tested. So they're being told the same thing, which is, you know what? I don't know. You may have it, but here's what we need to do. You should take the same precautions now as you would if you did have it. Let's just assume you have it. So all the things we just talked about, washing hands meticulously, being very careful around toileting, wearing a mask, even if you don't yet have cough or shortness of breath, because that can develop even after the diarrhea, in some cases, is the first symptom people get. And then 4 or 5 days later, they start to cough. So, behave as if you have it. Now, the reality is that's also not satisfying. And people want to know, okay, do I have it or not? There are stool tests available. And in fact, there is data now about stool testing in people who have clear-cut coronavirus. In one study, it was found that about 54%, over half of people do test positive in their stool, in addition to in their respiratory cultures. And there's evidence now that in some cases, people test only in their stool, but not in their respiratory cultures at all. Or they might test initially in their respiratory cultures, and then that clears up, but they continue to have it in their stool. In fact, even for weeks, up to 5 weeks after the respiratory symptoms have gotten better. And for about 11 days on average after the respiratory symptoms have cleared, there can still be evidence of the virus in the stool. Now, one thing I want to emphasize here is that test is not being made routinely available. It is a real test, but it's not being made routinely available, and the current CDC guidelines do not recommend at all doing stool testing. So we're kind of stuck right now with those guidelines, and it's dissatisfying for sure. And as a GI doctor, I want to know this because I have a suspicion that there are many people out there having diarrhea and fever right now who do have COVID. And in fact, I diagnosed my own friend with it, and he could not get tested. He had diarrhea. They would not test him. And he finally said, you know what? I'm a professor at a university working with students. I need to know if I have it or my students have it so the school can know. And he called the mayor of his town in New Jersey, where he lives. The mayor finally tried to weigh in, and eventually he got tested. And guess what? He was positive. Did not have cough, did not have shortness of breath, had diarrhea, and had fever. And he has a young child at home with who's on biologic therapies for juvenile rheumatoid arthritis, and he's been open about this story. He was, in fact, on CNN talking about it with Brennan, who is at particular risk for infection. Yeah. And yet he couldn't get tested, but he was smart and very early on assumed he had it, and he separated himself from his kids and his wife and put himself into the corner of the room and lived in a guest room for over 3 weeks.
And it's stories like that where, like what you were touching on earlier too, is we could potentially be spreading this virus in other ways and we not even realize it. And I touching on what you're saying here too, how can we potentially slow the spread if we're realizing that it could also be tested in our stool and it could be passed by if we're not paying attention to these bathroom habits? So what was some other ways that you guys have seen that we could potentially slow the spread here with the coronavirus?
Yeah, I mean, I think it's all those things. I mean, ultimately, this is really a public health question about public health policy, because the way our nation has approached this pandemic is not the same as, for example, South Korea, where they instituted drive-through testing for anyone who wanted to be tested immediately or very quickly.
Right.
And they didn't care if you had diarrhea, they didn't care if you had cough, or if you didn't have any symptoms at all. They just tested anyone who got in a car and drove through.
Mm-hmm.
Why is that important? Because those are the people who are not the ones who are in intensive care right now on a respirator. If somebody comes into a hospital right now with pneumonia and fever, you know what? Let's just assume they've got COVID and do everything we can to save their lives. But it's too late. They have COVID.
Right.
It's the people out in the community who don't know that they have it, who are unwittingly spreading it, who we need to figure out that they have it so that we can do contact tracing, isolate them, and figure out who they've been in contact with and let everyone know. And that's how these things work. At this point, it's a little bit out of our hands now because of the infectivity of this virus and the rate of spread. Now, there are some theories that it's spreading faster than would have been expected if it were just respiratory, and that raises the question of whether it might be passing through stool.
Right.
And, that question remains unanswered. What we do know, and I've said this already, is that just because there's genetic material of the virus found in the stool, which is how it's currently being tested, does not mean that that virus is infectious. It could just be dead. For example, if you swallow the virus because it's in your sputum and it gets all the way through the GI tract, comes out the back end, it could just be shedding dead stuff. But if the colon is infected, and we've seen this, and there's colitis, it kind of is hard for me to believe that somehow that virus sheds and dies the second it passes through your anus. Like, why would that make sense?
Yeah.
I think it is quite likely, and I hope I'm wrong, but I think it's quite likely that there is a possibility of live virus coming out in certain people. Now, there has been one study so far that's looked at this. It was published in the journal Nature just a couple days ago. And it got a lot of attention because it was in Nature, which is a major journal. And it's sort of an unfortunate study because they concluded that they did not find live virus in the stool. That's good, but the unfortunate thing is it was a study of 9 people.
Mm.
9. And those 9 people, 8 of them had 0 digestive symptoms. They did not have diarrhea, nausea, vomiting, abdominal pain. One of them had what they called intermittent loose stool. So the question is not, can we find live virus in 9 people without digestive symptoms? The question is, in people with active colitis, with active enteritis or small bowel involvement, with active diarrhea, can we find live virus in those people? But at least it's somewhat reassuring that they didn't find it in those 9. And the reason it was published is that's a very hard study to do. It turns out the methods to do a study where you determine if the virus is live or dead are very sophisticated and difficult to do. But we need more studies like that before we just all conclude, oh, we can just breathe a sigh of relief. There's no way this passes through stool. That's definitely not the case. And in the experts I've spoken to who know about this stuff, who are virologists and microbiome experts, they say we should be cautious about concluding that right now, that it's not infectious, that we do not have enough data yet.
Yeah. And I think is what you're saying too is so important to raise awareness that it could potentially be spreading through our digestive system and through stool. And I think that just raising awareness that maybe more research and involvement in that area to really get a hold on slowing the spread, because like you said, it's not the people who are already in like ICU. It's people who are out in the community and don't realize that they do have this virus that could potentially still be spreading it. And with research, maybe we can help to slow the spread by realizing that other people who do not have respiratory symptoms could potentially be spreading the virus as well. So I think that you really touched on a really good point of why the research in this area is really important. And for one other area, has the research at all come out about the long-term effects potentially of the coronavirus, not only on the respiratory end, but also with the digestive system?
Yeah, really great question. And we need to study this.
Mm-hmm.
I'll tell you what our plan is for how to study this, and at least my research group, and what we're planning to do. So, of course, we don't yet know long-term effects because this is such a brand new epidemic or pandemic. So we don't have enough data yet to establish what the long-term consequences are of COVID-19. Certainly the pulmonologists are concerned that there could be scarring in the lungs, and that some people are already reporting that even though they've cleared the virus, they feel more short of breath than they did before. And that's worrisome, that there might be a post-COVID pulmonary disorder where there's fibrosis or scar tissue that's laid down in the air sacs or the alveoli of the lungs that could inhibit pulmonary function in the future. We don't know if that's true yet because we need longer term data to find out if there are permanent changes in lung function. But what about the GI system, which is really our focus today? We don't know at all. The good news for me is that I do not think there's going to be scarring, for example, in the intestinal system. And I say that because for the most part, what we've seen is when it infects the intestinal tract, it's more of a typical viral gastroenteritis. And what that means is it's not generally, although there are exceptions to this we're starting to see, but it's not generally presenting with severe colitis, bleeding, although there are cases of that, but generally not bleeding. It's generally a lower volume diarrhea that lasts for about 5 days on average, about 4 times per day. The range is between 1 and 14 days of diarrhea, and it's generally not bloody. I keep saying the word generally because there are exceptions. Right. So that kind of diarrhea doesn't usually lead to scarring like you might see with inflammatory bowel disease, where over time you have this persistent inflammation that leads to scar tissue laying down. So I think, the intestine, unlike the lungs, the intestine is constantly replacing itself. The cells of the intestinal tract are constantly replacing itself. And we know that, for example, because when people take chemotherapy for cancer, which kills rapidly dividing cells, one of the most common side effects is diarrhea, nausea, and vomiting. So anyone that knows somebody or has been on chemotherapy knows that. And why is that? It's because the intestines are constantly replacing it themselves. So in a way, that's a good thing here, because if there's damage, the intestine can quickly replace that damage. Now, what I don't know is whether we're going to see more irritable bowel syndrome.
Mhm.
And that kind of concerns me. I hope not. We know there's post-infectious irritable bowel syndrome that occurs in around 10 or a little bit over 10% of people who have bacterial gastroenteritis, particularly with sort of Clostridium type of infections. But I should say Campylobacter-like infections. I take that back. But post-viral IBS has generally been less commonly reported, but we don't yet know what's going on with COVID here. Uh, I am concerned we may see an increase in IBS as a result of this pandemic, maybe because of COVID, or maybe just because of the overwhelming amount of stress that our entire world is under right now.
Mhm.
And we know that irritable bowel syndrome is a complex disease of brain-gut function. It's not straightforward. It's not that it's all stress. It's not that it's all in your head. We've never believed, at least I've never believed that. It's complicated. But we do know that stress and anxiety can change stress hormone levels in the body. That can change how the intestines move, can even likely affect the microbiome to some degree. And there may be, in some people, changes that may not go away right away, even after this pandemic goes away. So we need to monitor for irritable bowel syndrome. And our lab is about to launch a survey in the next 1 to 2 weeks of 150,000 Americans to find out more about what GI symptoms people are experiencing right now, whether they've been diagnosed with COVID or not, and whether they are having GI symptoms. But we're also going to then repeat that survey in 3 to 6 months to see what's going on after this is done. And we're fortunate because we already did this study about a year and a half ago. So we have baseline data before this pandemic, so we can compare the prevalence and incidence of IBS before versus after this pandemic.
That is awesome, and I think that is so good to know that we have researchers out there like yourself who are really monitoring the things that are going on in the patient community during this pandemic. Because, like you said, stress is a major part in a lot of um, symptom flares for patients with gastrointestinal disorders. So, first, thank you for taking that step in researching to figure out some of the things that patients may be going through right now. Is there any other advice that you might have for the general public right now and about the coronavirus and things that they can do in order to not only keep themselves safe and healthy, but also to help us slow the spread?
Well, I would say that we've talked about a lot in terms of cleanliness and hygiene and that sort of thing. But I'd also say it's really important to keep track of your mental well-being right now also. Because a lot of people for the last couple of weeks have been sitting at home wondering, do I have coronavirus? I mean, I'd be lying if I said I haven't gone through that mental exercise. A little cough, a little sniffle, a little sore throat. I've been talking a lot for the last 2 weeks, doing interviews like this, and a couple of days ago, I realized I had a sore throat. And the first thing I thought is, oh my God, I have coronavirus. But then I thought, no, I've actually been talking nonstop for a week. Maybe I just have to rest my vocal cords. Okay, so thankfully that got better. So I think we're all going through this, and I think it's important to recognize that stress itself has effects on the body, not just on the mind. We know, and we talked about this already, that stress can cause diarrhea, can cause constipation, can cause chest discomfort, can cause a feeling of shortness of breath, can cause headache, jitteriness, rapid heart rate. All of those body effects of stress can look and feel like an infection. Stress does not cause a fever. So if you have all that plus a fever, I think now it's a little bit different. But without a fever, for chances are you do not have coronavirus, although I hate to say it, but there are cases of diarrhea without fever in coronavirus, but most of the time, at least 70 to 75% of the time, there's a fever too. So if you have these symptoms, the first thing you might ask yourself is, okay, I understand I'm afraid I have coronavirus, but could I really be stressed? Even if you've never felt stressed like this before, everyone has this right now stress response. So could I be stressed? Do I need to think about meditating? Do I need to think about using virtual reality, which is something in another life, on Earth, back on Earth 1? We're on Earth 2 right now for a little while. Back on Earth 1, most of my research these days is on virtual reality and how can we use VR to escape the four walls of our home where we're isolated. How can we use it to meditate in a forest or go to a beach or just to take our mind off of this constant rumination and focus on COVID-19? Those are things that we need to be trying to do right now to put our mind at ease as much as we can within this unprecedented time that we're living through. And just know that we will get through this. Of course we will. You probably don't have COVID just because you have diarrhea. If you do, remember, over 80% of people have mild symptoms, and even among the 20% that have more severe symptoms, the risk of mortality, which is everyone's worst fear, remains thankfully extremely low. Even though we hear every day about tragic cases, the individual risk that any one person, you listening to this, that you are going to die of coronavirus is very, very, very small. It still is the case. Not to undermine it, not to take it seriously, but just statistically, it's hard to keep that in mind, but it's still thankfully the truth. So I hope that's helpful and that the information is helpful and that we all get through this together.
Yes, thank you so much, Dr. Spiegel, for sharing your unique insights.